Pascal pattern scan laser photocoagulator is recently developed by Ophthalmology Corporation USA, which is a significant improvement in laser delivery systems. Pascal photocoagulator incorporates semi-automated, multiple pattern, short pulse, multiple shot, painless, and precise laser burns in a very short duration in a predetermined sequence with frequency doubled YAG laser 532 nanometer. Pascal photocoagulator can be used in all the retinal diseases, proliferative and non-proliferative diabetic retinopathy, diabetic maculopathy, branch and central retinal vein occlusion, retinal tears, and peripheral retinal degenerations, choroidal neovascular membrane, retinal telangiectasia, retinopathy of prematurity, etc. Treated with conventional single spot lasers, argon, frequency doubled, YAG, krypton, etc. Advantages of Pascal photocoagulator over conventional single spot lasers. Pulse duration is very short, 10 to 20 millisecond, compared to conventional single spot lasers, 100 to 200 millisecond. Hence, Pascal causes less collateral damage to the eye with similar effective regression of new vessels. The size of the retinal burn remains relatively stable after Pascal photocoagulation due to low intensity. In conventional single spot photocoagulation, the laser spot burn enlarges with time. In case of conventional single spot photocoagulation, the laser spot burn enlarges with time. Hence, Pascal laser burns are less destructive than conventional single spot laser spot burns. Pascal is as efficient as conventional single spot photocoagulators. The gradation of retinal burns are the same but can be titrated more easily. Pascal allows the laser surgeon to apply different patterns of treatment with variable retinal grades of coagulation. Since the eyeball is spherical in shape, semicircular pattern is better suited for photocoagulation of retinal periphery, and standard square pattern is ideal for retinal mid-periphery. Circular pattern is suitable for treating retinal holes or breaks. So, what should be the shape of Pascal focus? It should be semicircular for photocoagulation of the retinal periphery, then standard square pattern for retinal mid-periphery, and circular pattern for retinal holes or breaks. Pascal allows the laser surgeon to adjust the individual spot size, adjust the distance between the spots perfectly, and the pattern of the spots with much more precision than is possible with a conventional single spot photocoagulator. Pascal allows the laser surgeon to place multiple spots in one depression of the foot pedal. Pascal allows the laser surgeon to complete PRP, pan-retinal photocoagulation, in a regular pattern more quickly and usually in one day. Short treatment duration leads to improved patient cooperation and fixation. Pascal allows the laser surgeon to place burns in distant retinal periphery in a regular pattern in PRP, peripheral retinal degenerations, and retinopathy of prematurity. Pascal allows the laser surgeon to place burns in macular grid laser more accurately in a regular pattern compared to conventional single spot lasers. Increase in macular edema following confluence of retinal burns is extremely low compared to conventional single spot photocoagulator. Since the distance between the spots is perfectly spaced, accidental confluence or overlapping of laser spots is not possible. Hence, patient's field of vision is much better after Pascal photocoagulation than conventional single spot photocoagulation. Single spot mode for conventional photocoagulation is also available. Using the Pascal method, physicians can deliver up to 56 spots in approximately 0.6 seconds. Patients experience less pain than with traditional single spot laser photocoagulation, reduced treatment duration. Disadvantages of Pascal photocoagulator. The spot size available is restricted, only 100, 200 and 400 micrometer. Spot sizes of 150, 300 and more than 400 micrometer are not possible. Inability to design the laser patterns at the surgeon's convenience. Pascal photocoagulator produces some noise when activated. Pascal photocoagulator emits green wavelength, which is difficult to penetrate through media opacities, for example, cataract, retinal and vitreous hemorrhages. Pattern burn with Pascal photocoagulator in retinal periphery is often difficult, and always use lower intensity by titration in retinal periphery to avoid intense burn. Precise, predetermined settings. Square arrays 2x2, 3x3, 4x4, 5x5 for proliferative diabetic retinopathy. Triple arcs for retinal tears, lattice degeneration, and proliferative diabetic retinopathy. Modified macular grid for diffuse diabetic macular edema. Single spot mode for conventional photocoagulation. Optimedica holds the exclusive license to Pascal photocoagulator technology, which was originally developed at Stanford University. Since its worldwide market introduction in 2006, Pascal photocoagulation procedures have been performed on tens of thousands of patients worldwide. So I'm going to add one video on Pascal photocoagulation so you can have a better idea what it is. Thank you so much.
This is the Pascal Synthesis 532. It's a multi-specialty workhorse. It has the capability to do single spot lasers, LIO lasers, pattern generation with multiple different patterns, optimized for PRPs, optimized for retina tears. Also has the capability to do subthreshold treatments for DME, for CSR. If you have multi-specialty practice, you have the capability to do pattern scanning, laser trabeculoplasty for lowering your IOP pressures.
Pascal offers macular grid options, including the use of one or more octants. Square arrays are tailored for PRP treatment, with smaller square patterns with tighter spacing, and triple arc patterns for the periphery. For retinal tears, triple arc patterns or a series of concentric rings ensure a full seal with as few as 3 foot switch depressions. To address limitations in conventional photocoagulation, Ophthalmology has developed the Pascal method. Pascal is a breakthrough pattern scanning technique that controls the delivery of laser energy in 3 fundamental ways: short pulse duration, uniform predictable pulses, and precise spacing of patterns. The key to Pascal is its proprietary advanced control system, which is fundamentally different from conventional lasers. Pascal uses 3 high-speed computer-driven galvanometers to individually deliver each spot in the pattern, resulting in a 25-spot PRP pattern being delivered in approximately 500 milliseconds. Pascal's laser fires a continuous beam at the first high-speed galvo, located in the laser console. A mirror on this galvo momentarily directs the beam into a fiber optic cable to create a pulse. This pulse travels through the fiber optic cable to the slit lamp, where Pascal uses 2 additional galvo mirrors to deliver the pulse from the fiber to the retina. While the galvo in the laser console is directing the beam away from the fiber, the 2 slit lamp galvos move into position for the next pulse in the pattern. The process of selectively directing a continuous laser beam with high-speed galvo mirrors allows Pascal to achieve short pulse durations, in which every spot in the pattern is delivered with the same power, resulting in more uniform burns than with conventional lasers. Repeatability is ensured by computerized safety checks of the laser power and galvo positions at a rate of 100,000 times per second. Pascal's unique combination of short pulse duration, uniform pulses, and precision spacing has important effects on retinal tissue. In photocoagulation, light is converted into heat as it is absorbed by the melanin and hemoglobin in retina pigment epithelium, or RPE. With longer pulse durations, more thermal energy spreads in all directions, heating larger volumes of tissue. As seen in histology, Pascal's short pulse durations reduce heat diffusion into the retina and choroid. Less lateral heat diffusion results in less RPE damage. Decreased anterior spread of heat into the retina results in reduced damage to the inner retina and nerve fiber layer. Limited posterior heating of the choroid decreases activation of the choroidal pain receptors, which can minimize patient discomfort. In addition, Pascal's uniform pulses and semi-automated pattern delivery prevent further collateral damage that can result from uneven power and irregular spacing of traditional laser pulses. Pascal's control system and galvanometers work together to rapidly deliver a selected pattern with controlled and precise spacing. Pascal offers macular grid options, including the use of one or more octants. Square arrays are tailored for PRP treatment, with smaller square patterns with tighter spacing and triple arc patterns for the periphery. For retinal tears, triple arc patterns or a series of concentric rings ensure a full seal with as few as 3 foot switch depressions. The ability to precisely deliver multiple uniform spots to the retina with shorter pulse durations and greater physician control makes Pascal the new standard in photocoagulation.